Today we are discussing a topic that touches the lives of millions of families worldwide, Alzheimer's disease. It's a devastating condition that not only impacts the persons with the disease but also their loved ones. But here is the good news. There is hope, there is support, and there is a path to understanding and managing this condition. In this video, we will shed light on Alzheimer's disease, discussing its causes, symptoms, and the latest advancements in research and care. First thing first, what is Alzheimer's disease? So, Alzheimer's disease is a brain disorder that makes it hard for people to remember things, think clearly, and do everyday tasks. Imagine brain is a library and all memories and thoughts are books. And that particular books on the shelves. In Alzheimer's disease, in Alzheimer's, the librarian means brain start misplacing and mixing up the books. So people might forget favorite food, how to tie shoes, or even the names of loved ones. Over time, more and more books means more and more memories get lost, making it difficult to live a normal life. Alzheimer's disease is a serious condition that affects millions of people, specifically older adults. And there is no cure for it yet. Scientists and doctors are working hard to better understand and find ways to help those who are having Alzheimer's. Alzheimer's disease can be divided into two main types, early onset and late onset. Early onset Alzheimer's is a quite uncommon and it typically affects people who are younger. For example, think of a person named Rahul who is only 50 years old but starts having memory problems and difficulty with daily tasks. He may have early onset Alzheimer's. Late onset Alzheimer is the more common type of Alzheimer's and it usually affects people who are older, typically over the age of 65. Imagine a person named Anand who is 70 years old and began to forget important things like where he put his car keys or the name of his grandchildren. He might be experiencing late onset Alzheimer's. These two types of Alzheimer's share similar characteristics, but they differ in the age at which they typically start. Both types involve memory loss and cognitive decline, which can be challenging for individuals and their families. The exact cause of Alzheimer's disease are not fully understood, but scientists believe it's a combination of factors like first, genes. Some people have certain genes that make them more likely to get Alzheimer's. It's like having a family history for this particular disease. Second, protein deposit in the brain. There are abnormal proteins that build up in the brain of people with Alzheimer's. Third, inflammation. Sometimes the brain gets inflamed, like when any individual have sore throat, this kind of inflammation may harm brain cells. Fourth one, emotional trauma. Research also suggesting that if person live traumatic life, if they are facing any emotional trauma, traumatic experiences, then also their neuron will be damaged and chances of Alzheimer will be there. Alzheimer's disease has various symptoms and they often start slowly and get worse over time. Imagine a person named Rahul to understand these particular symptoms. First, memory loss. Rahul might forget things like where he put his keys or important dates like birthdays. Second, confusion. He might get easily confused even in familiar places like his own home or around their house. Third will be difficulty with task. Rahul could have trouble doing everyday tasks such as cooking a meal or getting dressed. Number 4, language problems. He might struggle to find the right words or have trouble following a conversation. Number 5, mood changes. Rahul's mood might change. he could become anxious, frustrated, and even withdrawn from friends and family. Number 6, personality changes. His personality might change, making him act differently from how he used to, what kind of personality they are having. These symptoms can be like pieces of a puzzle, and as they continue, it becomes harder for Rahul to live his life. Alzheimer's disease affects not only memory, but also a person's ability to think, communicate, and function in day-to-day life. Alzheimer's disease affects the brain in several ways, like brain cell damage. Alzheimer's causes damage to brain cells, particularly in areas responsible for memory and thinking. This damage can lead to the death of these cells over time. And second, amyloid plaques. Abnormal protein clumps called amyloid plaque build up between nerve cells. These plaques can interfere with cell communications and contribute to cell damage. Third, tau tangles. Twisted tangles of another protein called tau develop within nerve cell. These tangles disrupt the cell's internal support structure, leading to cell malfunctioning. And fourth, that is shrinking brain. Over time, the brain of someone with Alzheimer's may shrink, affecting the overall size of brain and their structure. These shrinkages continue to decline in cognitive function. Fifth, reduced brain chemicals. Alzheimer's can lead to a decrease in certain neurotransmitters, which are chemicals that help brain cell communicate. This particular chemical impairs thinking and memory as well. Diagnosing Alzheimer's disease typically involves a combination of methods, and you are right, you are correct. There is no single definitive test. There are few healthcare professionals can play a role in diagnosis, like first, neurologist. A neurologist specializes in diseases of brain and nervous system. They can assess a person's cognitive function and conduct neurological exams and use various tests and scans to help diagnose Alzheimer's disease. Second, psychiatrists can also help individuals to diagnose Alzheimer's. Number third, psychologist. A psychologist with special training in testing memory and cognitive function can also perform detailed cognitive assessment and help individuals to diagnose Alzheimer's. This can be an important part of the diagnostic process. Diagnosing Alzheimer's disease often involves a thorough evaluation of the individual's medical history, cognitive function, and sometimes brain imaging like MRI or CT scans. It may also include blood tests and discussion with family members or caregivers who have observed changes in individuals' behavior and memory from last few months to years. The combined expertise of these healthcare professionals help make an accurate diagnosis of Alzheimer's disease. Alzheimer's disease progresses through distinct stages. In the early stage, individuals may struggle to find the right words, forget names of newly introduced people, and face challenges in social or work setting. They may also forget recently read information and misplace valuable objects. The middle stage is marked by more pronounced symptoms, including forgetting personal history, mood swings, and withdrawal from social interaction. And in the late stage, those with Alzheimer's require assistance with daily activities and personal care. They have great difficulty in communicating and experiencing significant physical limitations, including walking and swallowing issues. They also become more susceptible in infection like pneumonia. These stages help us understand the progression of disease and the evolving challenges that individual and their caregiver face as Alzheimer's advances. If you know someone who are having these symptoms, help them out to reach at a specific professional. And I am very hopeful that you got something from this particular video. Thank you for watching.